Hi, this is Jaya with you. Today we are going to see about circulation of the heart. Blood circulation is the foundation of our cardiovascular system. We need continuous blood flow through the heart and body to stay healthy. The circulatory system consists of four major components: heart, arteries, veins, and blood. They work together to ensure continuous blood flow throughout the body. The blood circulation process in the heart mainly involves taking in deoxygenated blood and pumping out oxygenated blood to supply oxygen and nutrients to every cell and removes waste products like carbon dioxide. Blood enters the heart through two large veins. The superior and inferior vena cava directly empty the deoxygenated blood from the body into the right atrium. The superior vena cava brings blood from upper part of the body, the head, neck, arms and chest. And the inferior vena cava collects blood from lower part of the body, the legs, feet and organs in the abdomen and pelvis. As the right atrium is filled with blood, it contracts. The pressure in the right atrium increases. The tricuspid valve pushed open and blood flows to the right ventricle. Valves open and close passively in response to pressure changes in the atria and ventricles as the heart contracts and relaxes. When the right ventricle is full, the tricuspid valve closes to prevent blood flowing back into the right atrium. From the right ventricle, blood cannot go directly to the left side of the heart. Heart can only pump out blood, but it cannot purify the blood. So it has to go to the lungs for purification. Lungs are filled with air. The circulatory and respiratory system work together to sustain the body with oxygen and to remove carbon dioxide. While the right ventricle contracts, pulmonary valve opens and blood is pushed through the pulmonary artery to the pulmonary capillaries in the lungs, where it gets oxygen and releases carbon dioxide. Capillary walls are very thin so that the substances can get in and out of them easily. The exchange of gas occurs between the alveoli and the pulmonary capillaries by diffusion. The pulmonary veins directly empty the oxygen-rich blood from the lungs into the left atrium. Pulmonary arteries are the only arteries that carry deoxygenated blood. Similarly, pulmonary veins are the only veins in the body that carry oxygen-rich blood. When the left atrium is full, the mitral valve opens and blood flows to the left ventricle. When the left ventricle is filled with blood, the mitral valve closes to prevent blood flowing backward into the left atrium and the aortic valve opens. Blood is pumped into the aorta to supply blood to the muscles of the heart and all parts of the body. Systemic circulation begins at the main pumping chamber of the heart from left ventricle. With each heartbeat, the heart sends blood throughout our bodies, carrying oxygen and nutrients to every cell. The aorta is the largest artery in the body. Like all organs, the heart muscle also needs oxygen-rich blood for pumping blood throughout the body. Although its chambers are full of blood, the heart does not receive any nourishment from this blood. The heart receives its own supply of blood from a network of arteries called the coronary arteries. Blood circulation to the heart muscle through coronary blood vessels is called coronary circulation. Coronary arteries are named as such due to the way they encircle the heart like a crown. Coronary circulation is part of the systemic circulation. Coronary arteries supply oxygenated blood to the heart muscle. The coronary arteries splits into two from the base of the aorta. They are the right and left coronary arteries. The right and left coronary arteries and their branches supply blood to all parts of heart muscle. Also, oxygen depleted blood must be carried away. After receiving oxygen from capillaries in the heart muscle, the blood travels through cardiac veins, collects in the coronary sinus and then flows into the right atrium. Interruptions of coronary circulation cause heart attacks, in which the heart muscle is damaged by oxygen starvation caused by coronary ischemia linked to coronary artery disease. Right coronary artery supplies blood to the right atrium, right ventricle, sinoatrial and atrioventricular nodes. The right coronary artery divides into smaller branches, including right posterior descending artery and right marginal artery. These arteries deliver blood to 1/3 of the interventricular septum. Left main coronary artery supplies blood to the left side of the heart muscle, the left atrium and left ventricle. The left main coronary artery divides into smaller branches, including the left circumflex artery, left marginal artery, left anterior descending artery and diagonal branch. Its branches supply blood to other 2/3 of the interventricular septum. The left anterior descending artery supplies blood to the front and bottom of the left ventricle and front of the septum. The circumflex artery encircles the heart muscle. This artery supplies blood to the left atrium, side and back of the left ventricle. These arteries provide blood to the heart muscle. If there is any blockage, is the cause of myocardial infarction or heart attack. The aortic arch is continuation of the ascending aorta, that is in the shape of an arch, and connects the ascending aorta with the descending aorta. There are three major branches arising from the aortic arch: brachiocephalic artery, left common carotid artery, and left subclavian artery. Brachiocephalic artery. Brachial represents arm, cephalic represents head. It splits into right common carotid artery and right subclavian artery. Right common carotid artery supplies blood to the brain, right side of the head and neck, and right subclavian artery supplies to the right arm. Left common carotid artery brings blood to the left side of the brain and neck. Left common carotid artery, as the name indicates, common, is a part of vessel's name. It means it splits into internal and external parts. For example, the right and left common carotid arteries, both arteries splits into internal and external carotid arteries. Left subclavian artery, it lies below the left clavicle, supplies blood to the left arm. The brachiocephalic artery is located only on the right side of the body. There is no corresponding artery on the left. The left subclavian and left common carotid artery arises directly from the aortic arch. The aorta begins to descend in the thoracic cavity is known as the thoracic aorta. It provides blood to the muscles of the chest wall and the spinal cord. A pair of inferior phrenic arteries supply blood to the inferior aspect of the diaphragm. Then it passes through the diaphragm and enters the abdominal cavity. It is known as the abdominal aorta. Most of the abdominal organs receive blood from branches of the abdominal aorta. There are 5 major arteries that branch from the abdominal aorta: the celiac artery, superior mesenteric artery, inferior mesenteric artery, renal arteries, and iliac arteries. The celiac artery provides blood to the stomach, liver, and pancreas. The superior mesenteric artery supplies blood to the small intestine. The inferior mesenteric artery supplies blood to the large intestine, and the renal arteries provide blood to the kidneys as well as the muscles of the abdominal wall and lower spinal cord. The aorta ends just above the pelvis, where it divides into 2 common iliac arteries that provide blood to the pelvis and the legs. Femoral artery supplies blood to the leg. Thus, the blood moves from the aorta through the systemic arteries, then to arterioles and capillary beds that supply body tissues. It is like a tree. The branches get smaller and smaller as they get farther from the aorta. Oxygen and nutrients are released. Carbon dioxide and other waste substances are absorbed. Deoxygenated blood then moves from the capillary beds through venules into the systemic veins. The systemic veins feed into the superior and inferior vena cava, which empty the deoxygenated blood into the right atrium of the heart. It needs to get filled with oxygen and get rid of carbon dioxide. So the heart pumps it out to the lungs for oxygenation. Blood gains oxygen and get rid of waste in the lungs before flowing back to the left side of the heart. Then heart pumps this refreshed blood to the heart muscle and to all parts of the body. There are three different types of circulation that occur regularly in the body: pulmonary, systemic and coronary circulation. Pulmonary circulation is movement of blood between the heart and lungs. It transports deoxygenated blood from the right ventricle to the lungs through pulmonary artery to absorb oxygen and release carbon dioxide. The oxygenated blood then flows back to the left atrium of the heart through 4 pulmonary veins. Coronary circulation. Blood circulation to the heart muscle through coronary blood vessels is called coronary circulation. Systemic circulation is circulation of oxygenated blood from the left ventricle to all parts of the body to supply oxygen and nutrients, and return of deoxygenated blood from the tissue is collected by veins and vena cava, then re-enters the right atrium of the heart. That's all about the cardiac circulation. If you find this video useful, please subscribe, like and share. Thanks for watching. See you with another video. Have a nice day.